committed to providing a full spectrum of labor and delivery options for women all across San Antonio. And in March of this year, Methodist Hospital launched its Midwife program with the goal of supporting families who are seeking low intervention births, but still prefer the added safety of that delivery in a hospital setting, providing, of course, for both mom and baby. And here to tell us more about it is Lauren Gould, certified nurse midwife with Methodist Hospital. Good afternoon.
Hi.
All right. Of course. Now, for those who don't know, what exactly does a certified nurse midwife do?
So certified nurse midwives are registered nurses who then go on to become nurse practitioners. And so we have a specialized training in women's health and pregnancy. Nurse midwives do annual exams, pap smears, birth control, and ultrasounds. We order medications, we draw blood work, and then we also do prenatal care, pregnancy, labor, and birth. A lot of people hear the word midwife and they assume out of hospital birth or home birth. But actually 90% of deliveries that are done by nurse midwives are actually done in the hospital.
So let's talk about those benefits of, having, those midwife services in that hospital setting.
Clients that choose to have their babies with nurse midwives kind of in the hospital kind of get the best of both worlds. They can use their insurance. They can have kind of a low intervention approach to labor and delivery, which is really typical of nurse midwife style, and still have the kind of backup comfort of the hospital in case they need it. And so we have a lot of patients that choose inductions. We have a lot of patients that choose epidurals during their labor. And then we have a lot of patients that don't. It's sort of the best of both worlds. A lot of our patients are birthing in the hospital, but also moving around, wearing what they want, laboring in any position that makes them happy, delivering in any position that makes them happy, and really feel that they're partners in their own care.
So what does the traditional patient journey kind of look like for those who choose a midwife for care during their pregnancy?
So the journey isn't just pregnancy. So many of our clients have been seeing us for years for their annual exams, for their pap smears, for their birth control, and then they choose to then stay with us throughout their prenatal care and their birth. And so a client that chooses a nurse midwife would see that nurse midwife throughout their pregnancy for their prenatal care. We have a lot of clients that start with us at the very beginning of their pregnancy, and then a lot of clients that will transfer to us during their pregnancy or even towards the end. And then right now we're doing all of our births and deliveries at Methodist Hospital.
So anything else folks should know?
I think one of the big things to remember is that certified nurse midwives really believe strongly that the patient or the client is involved in their care. And so we really believe in a team approach, in a collaborative approach, so that the patient knows that how she feels about her birth and her experience and her care is important. We don't ever want a patient to feel like she wasn't included in her own care.
All right, Lauren Gould, certified nurse midwife with Methodist Hospital. Thank you so much for your time. You can schedule an appointment with a certified nurse midwife, and you can watch a virtual tour or enroll in prenatal classes with Methodist Hospital. All you have to do is call that number on your screen, 210-575-0355, or visit sahealth.com/maternity.